Hi guys. So what I was saying before I ran out of time is that when it comes to the surgery and the lasers, so lasers will be used, but for this one it's more like the pills are not working, the drops are not coming in clutch. You have tried everything and they're now offering you to do laser or surgery. So what lasers are going to do is that they're going to make a channel in your eye that is going to take out the fluids and let it flow better from the fluids in your eyes. So that way it doesn't take so much damage on your optic nerve. And I will advise always talk to your doctor about it. You're going to be very sick and tired to death of me saying this, but I cannot stress it enough. Talk about it, your concerns, your wanting to understand what's going on. You can look it up, though word to the wise, if you decide to look it up on YouTube, you may not like the images that you see because I did that once for like LASIK and cataracts, or like how they kind of can skim the top part of your iris to not have such thickness in your eyes. I regret doing that. I wouldn't advise it, but do you, respectfully. If that helps, go for it. But that's basically what they're going to be doing with lasers. If that doesn't work, or if they want you to do surgery, surgery is really for like if drops and lasers and the pills and all that doesn't work. Surgery is like a last resort. It's like your trump card. The one that has like surprise to take out everyone else, you know. Anyways, implants are going to be what your surgery is going to be about. And it's recently new. The implants develop that can help you. So I'm reading my notes and I'm also talking to you guys, so sorry about that. Anyways, it's going to be implants that develop kind of like how you would on a cataract surgery. They're going to kind of just put, I wouldn't say lens, but something kind of like that. I do not know the name of the surgery, and if I wrote it down, I would give you guys that, but it's something you can look into and see. Again, that is for like a last resort if the rest of the treatment is just not working. And it's just to keep your pressures leveled and maybe give you a chance to have whatever vision you have left at the time. But they're not going to just smack surgery on you and you walk in there or grab you, strap you down, and get lasers on your eyes, okay? Excuse me, that's just not something that's going to happen. Excuse me, I have the hiccups. Anyways, that is some of the stuff for glaucoma for opening angle. Now, how it starts is not really set in stone. You can have a family member that has it, and it can be something that's just passed down to you. That is not going to be something that everybody, so like, for example, if my dad has glaucoma, right, that means I'm going to get glaucoma, which means his grandfather or his mother had glaucoma, and it just kind of comes down in a line. It could be that I have glaucoma and my great uncle has glaucoma and maybe my kids' grandkids will have it. It's not like it's a chance of them getting it, but it's not set in stone that they're automatically going to get this disease. It can happen, it cannot happen. It goes any other way. So that's part of it. It could be passed down hereditary. It can also be that you know you're diabetic or have other health issues. That one in particular does affect your eyes, among other stuff. It can affect your arms and your legs, mobility, and so forth and so on. But this video is more about glaucoma, so I'm not going to go into that. But I'm just saying that if you do have it, it doesn't mean that you're going to get it too, that it's just a matter of time. It's a possibility. These are possibilities of getting it or having it given to you, or maybe a chance of maybe receiving this. Hopefully you never get it. Hopefully you never have to receive getting any type of glaucoma because it's a pain in the butt. But those are possibilities of why it happened or why it might happen. Another thing is if you are African American or have African descendants, it is very notable that a lot of people who are African do get this disease. I am black and white. I have the best of both worlds because I'm basically a human Oreo. Exactly. And this is a possibility of why I may have gotten it. I'm not saying it's set in stone, but like it's possibilities. They don't really know specifically how it's given. These are just, I say possibilities a lot, but these are just like facts that if you do have this is something that you should check into, make sure that you're not eligible of getting it or not coming close to having it. And that pretty much covers our opening angle glaucoma. Another one that we're going to go into on my next video is we're going to go to acute angle glaucoma. And though it has a pretty adorable name, it is not cute. Alright, thank you guys, and I'll see you in part 3 of acute angle glaucoma.